Hello, my name is Dr. Jucille Meneses. I'm a neonatologist from Brazil, and I'm here to present in Hot Topics in Neonatology Congenital Zika syndrome, an epidemic in Brazil. I have no relevant financial relationships to disclose. As you know, in 2015, in October last year, these were the countries that confirmed local Zika virus transmission, but much has changed since then. And now in 2016, we see all of these areas which are probable Zika transmission areas. In these areas, over 2 billion people live in these areas, and they are susceptible to Zika virus infection. I come from the northeast of Brazil. Pernambuco is the state, and Pernambuco is the state with the most cases of congenital Zika syndrome. I work in Recife, which is the capital of Pernambuco, in a hospital, in a public hospital, with around 5,000 deliveries per year. Recife is a beautiful city on the coast, but it also has the poor environment with lack of basic sanitation, overcrowding, and that makes a perfect scenario for the Zika virus to disseminate. How does the Zika virus have, and we know that it has a teratogenic effects on the fetus, and how are the teratogenic effects occur? How do they occur? One hypothesis, they might be by a direct transfer hypothesis by the Zika virus through the placenta. We know that it has neurotoxic properties and it might affect the placenta. However, at this time, early in gestation, we know that there's not much blood going on from the placenta to the fetus. So a second hypothesis is the placenta mediation hypothesis. The placenta has a pro-inflammatory response that disrupts normal brain development. And so here we need to know what mechanism is responsible for this, because if the placenta is responsible, that may enable us to directly treat the placenta with anti-inflammatory treatment, and that might diminish the injury to the fetus. As y'all have seen in lots of papers on literature, the congenital Zika syndrome has characteristics and features that are common. Craniofacial disproportion, overlapping skull bones, redundant skill scalp, small fontanelles, hypertonia, hyperflexia. They're constant crying. They're very irritable babies. Sucking reflex preserved. Neuroimaging, we have seen that, lots of papers that have shown distinctive pattern of the neuroimages associated with Zika virus. In the CT scans, what we found is calcifications, coarse and severe calcifications, a non-hypertensive ventriculomegaly, different from others, cortical hyperduration, very important, and sometimes you even have the most severe forms, which is the lysencephaly. And we also find cerebellum hypoplasia, which we don't find so much in the other congenital virus infections. As for the visual assessment, there are some abnormalities in the macular and the optic nerve, especially in the macular. And so these are other abnormalities associated with the congenital Zika syndrome. Now I'm going to show you our case series of 87 patients with the Zika congenital syndrome, and they were laboratory confirmed because all of them had IgM positive in their CSF. We not only did the ELISA IgM, but it was followed by the PRNT, which is a plaque reduction neutralizing test that really confirms the Zika virus. The antibodies for Zika virus has cross-reactivity with other antibodies, especially dengue. So you have to do the PRNT to eliminate these other antibodies. And we did this because of we have the reagents and we follow the protocol from the CDC, who kindly gave it to us. According to our mothers, 70% of them had symptoms in the second and third month of gestation. 91% had fetal ultrasound neuroabnormalities. The infants, most of them, 91% were term, 28% were small for gestational age. You see that their mean birth weight was 2,575 grams. And what really devastating is that 82% had severe microcephaly, below 3 standard deviations. You can see that the mean head circumference was 28 centimeters in most of them term infants. So you have this fetal injury going on throughout the whole gestation. Concerning the neuroimagings, as we see calcifications, ventriculomegaly, disorders of migrations, and cerebellum hypoplasia, as other authors have also shown. We had 18 cases of arthrogryposis, which has also been published. And what we found that we haven't found in other studies is 3 cases of unilateral diaphragmatic paralysis. We know there are some case reports that there is diaphragmatic paralysis associated to dengue in adults, but we have not found anything regarding association with the Zika virus. This here shows the head circumference mean Z-scores in infants with congenital Zika syndrome according to maternal neonatal characteristics and neuroimagings. As you can see, mothers below 18 years old, their infants had a smaller head circumference. The term infants had a smaller head circumference because the damaging in uterus in the brain continues to gestation. The small for gestational age infants also had a smaller head circumference, and the babies with visual abnormalities. So in summary, we want to conclude that congenital Zika syndrome is a global threat. It now belongs to the torch with a Z on the end for the congenital infections. Clinical features common to the syndrome, but it's beyond microcephaly. We have many associated malformations, arthrogryposis, and others that we have shown, distinctive abnormal neuroimaging, severe neurological disorders with very, very poor outcomes. And to confirm a case, the serological tests are needed with an IgM positive with PRNT in CSF or serum, preferably in CSF. What we don't know, timing of infection and gestation correlated to severity of the disease in the newborn, factors that enhance or protect the infection. The true burden of Zika infection still is underestimated. We have found now that children without microcephaly but having neuro abnormalities, and subtle effects may be revealed later into childhood. So the threat from Zika congenital infection is not basically only on clinical outcomes, but on the full range of potential health, social, and economic problems on affected children and families. Thank you very much.